Welcome. I'm super excited for you. Welcome to the medical community. We'll start out with a story. Just over a year ago, so it was July, I got called to the ward. The nurses were telling me this man was in respiratory distress. And I walked into the room, and he's a very sick fellow, had an ENT cancer, had surgery. It's in the midst of his radiation, and the guy was going like this. And his whole neck was collapsing with each in-breath. And I was worried that he had some type of defect from his surgery and that he may actually need a trach or some operation then. So I called the ENT team, and within 5 minutes, in walks this intern. The guy's, a month and a half into his internship, and he's carrying this little briefcase, and he kind of looks at me very calmly. Here's the story in a minute. And like out of a movie, he's like slick. He opens up his briefcase, he's got the scope in, he's putting the scope down this guy's nose, and he's seeing that the vocal cords are inflamed, and that's the cause of this guy's stridor. Asked the nurse to give some Decadron, and the guy settles down, the swelling goes down, he's getting better and better. That's you in 4 years' time. You are going to be part of a team. It may not be as dramatic as this, but I'm telling you that because what you're about to take on in the next 4 years, in fact, 2 years from now, you'll be on the ward and you'll be asked to be part of that team and to contribute and really make a difference in countless people's lives. So no matter where you go, no matter what you do, your life will have meaning. And I just want you to take away that one idea from today. And what I want to impress upon you is that you can reframe your perception about stress and feeling overwhelmed and challenged. And by doing that right now, you can take that new mindset into everything that happens to you within medical school, and you'll actually feel better and you'll actually perform better. So the data shows that a single intervention, half an hour, could change your quality of life for the rest of your life if you can change your core belief around stress. And that's what I hope to accomplish the next 20 or 25 minutes. So the main points from all this. Number one, take home this main point. Medical school is fun. It really is fun. It's challenging. It's fulfilling. You're going to learn a huge amount of volume of information. You're going to gain incredible skills over a period of time, and you'll gain competence. But it also can feel challenging at points. And so I want you to try to remember that this is about learning and being part of a team. The old paradigm of you working extremely hard to get into medical school, you can just drop that at the door right now. You're now part of a team. Everything that we do within medicine is teamwork. And I'm going to be calling you. I'm 20 years out since my fellowship and residency now. And so my memory of medicine is distant. And I might need your help at 3 a.m. asking for your opinion when you're an intern, a resident, young physician, specialist. So really, what you're doing is important. And it's fulfilling and it's fun because of that. So what I'm going to ask you to think about is this idea that when you're feeling kind of anxious and nervous, like going into an exam or maybe an OSCE or something that's clinical, that when you're feeling that kind of feeling of nervousness, that feeling is actually going to help you perform better. And that's the reframe that I want you to think about and consider as you're going through all of medical school. And we're going to do some simple techniques this afternoon. I'm going to teach you a few things this afternoon as to how to settle down your physiology, how to change your physiology and actually perform better. And we're going to start doing that right now, which is, can everybody stand up for me right now? We're going to do the power pose. Good. He's got it already. So you can, that's right, you can do that as well. Hands on hip. The idea is take up space. Take up space. You might have to turn. Lift up your chest. Look up high. That's good. That's good. It's energy. So we're going to hold this because the data shows if you hold this for 2 minutes, going into an exam, going into a clinical situation, going into a presentation, giving yourself that space, you actually change the physiology in your brain. You actually increase testosterone levels. You decrease cortisol, the kind of stress reaction. You increase your feeling of confidence. And I'll tell you the quick story. So I did it today, but anyways, I was being interviewed at Live in 5 World Cancer Day, so I've given TV interviews before, but it's always a bit worrisome what they're going to ask and so on. And I did the power pose kind of out in the sidelines before being pulled on, and I really felt like my posture was better, I was more connected, I was listening, I was engaged in the interview, and I really felt I performed better because of the power pose. So, first exam, I want you guys to be teasing each other and holding the power pose. The first OSCE, I want you guys to be joking with each other. Remember this? Do the power pose. It will help you. Give it a try. So, thank you. Thank you very much. There's a lot of good data around that, so it's not just frivolous. Increase your confidence.
That's a power move.
Okay, so let's get to the science of this. How many people think that stress is harmful to your health? How many people think that stress is not harmful to your health? No matter how you answered, you are right. Because I was in your category for many, many, many years until I read, well, this book that I'm going to tell you about. But anyways, this is a slide from a weekend retreat, people affected by cancer. Essentially, I was teaching stress is bad. It essentially eats away at every system in your body. You name the body system, I can tell you how stress has a negative impact. And so we thought about that, and we thought about trying to avoid stress and relax ourselves and so on. But I've actually changed my thinking. I've changed my core beliefs, and now I want to try to convince you that actually stress is actually a good thing. Okay, so Kelly McGonigal is a Stanford prof, has been teaching this, and I'm using her work, and she's relying on the primary scientific data. So typically we have two attitudes. The first attitude is stress is toxic, should be avoided, and we have to manage our stress levels. And some people will have that kind of voice within themselves when they're in a stressful situation thinking, oh, this is too much, my life is toxic, I'm not doing this, or I'm inadequate. And so that's the kind of core belief system that we can believe. But you can actually reframe this, and this is what I'm trying to provoke you to, is that stress is accepted, it's normal. In order to have a full medical school life, you need to have stress. You need to have that fulfilling experiences. You need to have challenges in order to push yourself and to learn. And you can actually use the energy of stress and embrace it ultimately. And in those circumstances, you can say to yourself, the new frame is, so this anxiety means that something is important at stake. I want to do well here. I want to learn. Or here's a good opportunity to learn is another way to reframe those same feelings of being stressed. So there's some interesting data around that. So they asked 30,000 Americans, do you believe stress is harmful, and how much stress have you been experiencing? So 2 questions around that. Then they followed them for 8 years and looked at the mortality within that. And sure enough, those people who really felt overwhelmed and stressed, they had a 30% relative risk increase in their mortality. But people who didn't feel that stress was harmful to their health had no increased risk. In fact, they were at the lowest category of mortality. If you're in that space where I'll do whatever I need to do and I'm not going to worry about this, stress is not harmful for me, I can take on this, it actually improved their overall mortality. Gallup in 2006 interviewed 125,000 people in 21 countries, and they created what they called a stress index, which is the percentage of people in that country who said yes to the question, do you experience a great deal of stress yesterday? So the average worldwide is 1 in 3, and there's a huge range from Mauritania at 5% to the Philippines at 71%. And Canada is probably like the States in kind of the 30, 40, 50% range. They wanted to know if there was a correspondence between a country's high stress levels as reported by the people and their health and their economic output, et cetera, et cetera. And you might presume that the higher the stress level, the more dysfunctional the society. In fact, the opposite was true. When they correlated that with well-being, life expectancy, health, satisfaction, the countries that had the highest stress levels also had the highest levels of that kind of health. They had the best economic output, and they had the greatest sense of community and connection with each other. Right? So it's maybe counterintuitive that what I'm saying right now. We know that people who are reporting higher levels of stress on average may also have higher levels of feeling anger, depressed, sad, worried. That's the kind of expectation. But those same people yesterday were more likely to say, I experienced joy, I experienced laughter and love as well. So there's a correlation between that fulfilling life and having all those emotions. And if you asked, and health and satisfaction overall, and if you ask the question, are you leading a meaningful life? And I'm arguing to you that you're going to lead a meaningful life from now on. It actually correlates highest, and it's the best correlative question with people experiencing a lot of stress too. So high stress also means high meaning. You're engaged in the world. Stress can be a good thing. Okay, I wanted to define stress because we can think, well, that was a stressful event, or those were stressful things, or those type of things. Stress is that kind of internal experience. And you can reframe that to anywhere to say it's the thing that occurs when something important to you is at stake. So that can be feeling flustered to having a life-threatening situation for yourself. So internal experience. And from a physiological perspective, from an evolutionary perspective, our brains are primed through multiple pathways to use that same stress response for multiple types of stressors. So the stressor is the thing, psychological or real, out there that's causing the stress reaction. And so if you're walking down the sidewalk and a car is coming over the curb, you'll have a stress reaction. Your body will respond and jump out of the way. So that's fight or flight, kind of brainstem, reptilian brain. Perceived threat, I'm thinking about going surfing this weekend. The waves are getting a little too big. I'm starting to think about that. I'm feeling a little bit stressed, actually. And so thinking about doing a dangerous activity is making me feel a bit anxious. Or if you have a cancer diagnosis, thinking about your tests, for instance. But why is it that we feel that same sense of kind of panic when we have to present in front of a group and so on? And I'd argue that it happened probably in the Serengeti thousands and thousands and thousands of years ago when we lived in tribes for thousands of years, tens of thousands of years. Because if you're ostracized from the group, it was as good as a death sentence. So we are very primed through our frontal lobes to stay connected with others and stay in good with the group. And so we are stressed from social circumstances. And lastly, I also just want to empathize with you. The unknown is also just stressful, right? And it's normal for you to feel stressed at the start of medical school. And the question that I suspect goes through a lot of medical students' minds for a long time is, will I be competent? Will I hurt somebody, right? And just as a quick aside, there's always somebody else to help you out. You're going to be part of a team. You can always ask that question and so on. But essentially, it's the unknown that is stressful. And that's okay. It's also very exciting. Okay, I want to work with this curve a little bit. You've seen it before, probably inverse U-shaped curve. Interesting for me, your performance level is actually a little bit better when you're a little bit outside of your comfort zone, right? So you're a little bit more primed from a stress perspective. And there is a place here to be able to recognize when you're feeling really upset and kind of breaking down and like totally overwhelmed or angry. If you can recognize that through kind of a sense of mindfulness, then you can bring yourself back onto the curve and be able to perform better. So mindfulness, settling down your physiology, using your frontal lobe to reassure yourself, has its place in this kind of bottom right-hand corner. My hope is that by reframing, by understanding the stress reaction, you'll actually bump yourself up to the top curve, meaning that you'll be able to perform very well, maybe not perfectly optimally, but perform very well when you're feeling in a greater sense of stress. So that's the idea, is the stress management, the insight, and reframing your stress reaction will keep you engaged and functioning and not having you kind of burn out and fall apart. Okay, so I'm going to just focus then on trying to go from the overwhelmed scenario to getting your brain going, frontal lobe engaged again. So I want you to think about the last time when you really feel stressed and upset, overwhelmed, scared, anxious, angry, flustered. What was happening within your life? And we're going to do a quick mindfulness exercise to have you try to remember what are the cues that were telling you that you were having a stress reaction. So as you're in the midst of the situation, kind of scan your body in memory. Was it pounding heart, short of breath, jitters, mouth dry, sore throat, tight shoulders, adrenaline going, jitters, acid stomach, wanting to go to the bathroom. Could be any of those cues to say that you're having a stress reaction. What was happening emotionally? Were you seeing red? Were you numbed out? Were you feeling like crying? Were you feeling agitated emotionally? Could be any cue there to tell you that. What was happening to your thinking? Most people get either more focused, so that it's thinking only one idea, or they fuzz out. They can't think at all. They've lost their ability to move forward. And lastly, imagine that there's a special computer program that could type down your thoughts all day long, every thought that you write, and at the end of the day, you read your printout. That's good blackmail material, I think. Yeah. How would you know from reading your transcript that you were stressed? So for instance, for me, if I'm swearing in my mind, I know I'm usually stressed, calling people's name, labeling, this is unfair, this is bullshit, whatever it is, right? You know, those are the cues to say, oh, I'm getting kind of ramped up here. And do I need to? Okay, so recognition. Okay, I'm going to ask you to stand up again, and we're actually going to go through a scenario. This is a scenario where you're really kind of overwhelmed and feeling stressed and so on. And 99 times out of 100, you can actually press the pause button. Right? You're about to go in and tell this woman she's got metastatic cancer and it's incurable and she's a young mom. Right? And so that's a stressful situation for the first time around in real life. And so when you're outside the room, you can actually press the pause button. You know, yes, if someone's got chest pain or they're short of breath or they're bleeding, you have to just react. But for the most part, if you're feeling super stressed, you can actually settle down your physiology. Okay, so I ask you to put your hands on your abdomen right now. And I want you now to focus on just being very curious about the physical sensations that are happening within your body. Be mindful of what's happening physically to you. And with that, you move out of the kind of the brainstem, primitive system up into frontal lobe, being very curious. Next, I want you to take 4 slow breaths with a longer out breath. So you're in and out is probably going to total 10 to 12 seconds. Breathing in and then longer, slower, more comfortable out breath. And just continue to do that as I kind of talk you through that physiology. Slow out breath. And focus on the sensation. What does it feel like? What does the breath feel like? What does your body feel like? Bring your attention back to being grounded. Excellent. Okay. 4 slow breaths, and then at that point, you've actually come out of the kind of primitive stress brain up into your frontal lobe, and you actually use that wise and kind part of your brain that says, no, I've been through difficult situations before. I can take this one step at a time. I can do this. Or whatever, however it is, you kind of reassure yourself, right? Great. Thank you very much. You can have a sit again. Did you actually notice yourself settling? I saw the energy in the group kind of settling in there. That was great. Wonderful. So when you're decompensating,
I can relate to that.
When you're decompensating,
Paid for it.
Thank you. It's okay. I'm happy you're lively and engaged. And that's why I got you in first week and not a month from now. So I want to talk about this idea then. If you're not like totally stressed and have to get yourself up into the space where you can actually talk to yourself and kind of reassure yourself, then there's this idea of actually trying to settle yourself down versus just accepting and embracing the anxiety. And there are lots of different variations of this. People giving a persuasive speech, and half the participants were said, when you're feeling anxious there, what we want you to do is to say, I'm going to calm myself, I am calm, I'm relaxed, I'm in that space. And half of the participants were told to say, I'm excited, I'm engaged, I'm going to enjoy this activity type thing, right? And then they actually videotaped them and then had blind observers watch the videotapes. Those who were taught to reframe to be excited actually had a greater sense of confidence, so they self-reported more confidence. They were more persuasive, confident, and competent. So they were more likely to get hired in a job interview, for instance. So trying to settle oneself down isn't as effective as saying, yeah, I'm feeling nervous and I'm going to use this energy. And this same thing was done for writing the GRE, which is the graduate school exam. And I'll just read that to you. So the experimental arm was People think that feeling anxious while taking a test will make them do poorly. However, research suggests that stress doesn't hurt performance on tests and can actually even help performance. People who feel anxious during a test might actually be doing better. So when you're feeling nervous, you can say, actually, it's helping me. And there again, it was randomization between, just do your best and this intervention. And the results on the practice exam were that people did better, significantly better on the math section with no change in verbal, which is actually interesting kind of physiology, kind of a thinking higher abstract versus a more primitive verbal. And the people who actually said, I'm excited, I can do this, and my anxiety is a good thing, had higher cortisol levels. And that actually correlated with higher scores, especially for the reframer. So you have to reframe to say, this is actually helping me. And at the real test 3 months later, it actually, again, the randomization showed there were higher scores on people who were able to embrace the anxious feelings. Okay. I find this particular study really, really interesting. It's essentially lots of variations on the social stress tests. It would be like me saying, you, sir, you, ma'am, please come up here and give me a 5-minute speech about your strengths and weaknesses. Go. And having somebody sit here and then, talk to the whole class. But the variations are they have cameras going and lights and so on, and they have mock interviewers who are going to give them feedback, or they stonewall them, or look at their watch and do all sorts of things, or they interrupt, say, oh, your body language is terrible, stand up straight, or give me a better example. All sorts of ways of making people feel really stressed when they're giving a presentation in front of an audience. So it's a social stress test. The randomization is either, sometimes it's just a 3-minute video saying, half the people saying stress is bad for your performance, you can't concentrate as well, and half the people had the video that said essentially stress can be very enhancing. When you feel your heart beating, it's actually giving more energy to your body. When you're breathing hard, getting more oxygen to your brain, stress is actually going to help you. And the people who were taught that they could reframe their stress reaction actually perform better. Again, they were more confident, determined, excited, for themselves and for the people reviewing the films. Not only that, there's actually a change in physiology within the brain. DHEA is a precursor to testosterone. So below the neck, essentially, you release DHEA in response to exercise, which primes your muscles to get essentially stronger. So you release DHEA during exercise. Within the brain, it's actually a neurosteroid that actually allows you to learn better during stressful experiences. And after a stress experience, your brain actually continues to kind of work on the material of that stressful experience. And the higher the DHEA, the more you're able to reframe and learn that way. The DHEA to cortisol ratio is called the growth index, and it's associated with lots of positive things in people going through stressful responses. So by simply saying, this is actually helping me, my heart's pounding harder, I'm getting more blood, I'm more focused, when you're feeling anxious, you actually change your brain chemistry. The other thing that's interesting during a stress reaction is that we actually release a hormone called oxytocin. It's this famous kind of cuddle hormone, but also released during childbirth to help the uterus contract, letting down milk, breastfeeding. So lots of kind of social things around oxytocin. It's released during stress. And what's interesting about this one is it actually has an influence on how our brain works. So you'll need empathy in medicine, insight, et cetera, but it also drives pro-social behavior. So think about it. When you last had the flu and were feeling really crappy, didn't you want to like be with somebody or reach out to somebody, kind of the man cold type of feeling, that scenario? There's a tend and befriend response to oxytocin. We want to connect with others when we're feeling stressed. The takeaway partly for you is that it is very healthy for your body, allows your body to heal itself. It's kind of anti-inflammatory. And I really want you to think about this one. You're going to go through very challenging periods within medical school. And when you're feeling overwhelmed and just under the weather, reach out to your friends. Talk about it. Find somebody within your life that you can just be totally honest with. So either help somebody or be helped by somebody. Ask for help. you actually release oxytocin by doing that, and it actually ups your performance in terms of how your brain actually works. So again, use your brain physiology to connect and help yourself learn better. Other neurotransmitters released during stress, so the dopamine system is actually primed. It's not just all bad. It dampens our fears and allows us to react, right? You go into a very stressful, scary situation when someone's really sick. You're going to have a dopamine response to keep yourself focused on what's happening there. Serotonin also attunes us to what the reality of the circumstance is, so we can use our perception and intuition and understand what's really needed. So again, we don't really hear about these other neurotransmitters during the stress reaction because we all think it's all bad. I think it's cortisol and adrenaline. So the idea is even in peak performance, people like professional athletes in the zone or musicians that are in the midst of their best performance or a surgeon when they're in the flow of things, they actually have a stress response. They're not totally relaxed. So there's a stress there, but they also feel excited and energized and confident that they can do it. So we want that sense of energy going into difficult circumstances. I will agree with you that stress is not good for you if it fulfills three things, but I also want to reflect you're in medical school now and you're going to be physicians in some sense or form in the future. And so if you feel inadequate to it, the curriculum is set up, you have the ability to do this. You can succeed in medical school. All you have to do is put in the effort and care. If it isolates you from others, you always have the opportunity of reaching out, right? You can share. Again, I don't mind if you make fun of the power pose or I'm excited, prior to your exam, but have fun with this and connect with others as you go through this together as a team. And it feels utterly meaningless, which is just not true for you. Your ability to learn these things will influence how you can serve countless people in the future. So you have the ability to reframe stress as a positive thing. And last thing I'd say, becoming a physician is kind of like starting out with never being able to play the piano to thinking that you're going to actually perform something that people are actually going to enjoy. It takes years of practice, right? And you're going to hit up against your challenges. You're going to hit up against things that will be difficult for you. And that's okay. It means that you're learning. And so if you have the attitude when you don't do as well as you wanted to, well, at least I learned from this. I'll do better next time. And if you have that kind of growth mindset, you will actually do better next time around. Okay, so typically this is the kind of takeaway strategy around stress. When you're feeling a sense of anxiety, you do not have to push it away. You can actually just say, this is what's happening. Be mindful like we were mindful. We actually welcome the stress and say, well, this is important to me. I want to do well in this exam, or I want to do well on this OSCE. What's my priority here? Maybe I can be kind as I'm doing this. Maybe I can help my classmates as we're working towards this exam. And then you can make use of the energy, right, by reframing and having your brain work better. Okay. Lastly, so I've just talked about this kind of acute stress, sudden bursts of when you're feeling anxious. And there's this idea that you want to put yourself in a position where your life is balanced. And I just want to offer you this kind of quick physiology, the hand model of the brain. So essentially, the base of the thumb is the brainstem, reptilian brain. And thumb becomes the limbic system, emotional approach, reward center. And then you have your neocortex that wraps over top here, which is your frontal lobe. And you see the anatomy of the frontal lobe relative to the limbic system. It's right there. The stronger your frontal lobe is, the more it can kind of dampen down the kind of anxious feelings within your brain. So you don't want to flip your lid. You want to stay engaged all the time. So, and so there are healthy habits that allow you to stay online for your frontal lobe. And I'm going to actually start asking questions around that. What's a situation in which you can't concentrate as well, or that your frontal lobe is not working well?
You're tired.
Tired is number one, right? So obviously, you want to get a good night's sleep, keep yourself in balance. I could rant on this one all by itself, but I just add this one. Taking a nap of 10 to 15 minutes, getting into a little bit of REM before 5 p.m. every day, allows you to learn better after the nap, improves the quality of sleep that night, and you wake up more rested the next day. So I'm a napper, just to let you know. Don't tell my boss. But it actually, there's sleep hygiene ideas, right? Not to put the screen on half an hour before bedtime, so sleep. Number 2 healthy habit? Hungry, yes. So hungry, and it actually spikes the sugar. So the sugar can go too high and the sugar too low. So a healthy diet releases the glucose into the system faster. Number 3 healthy habit that allows your brain to function best. Exercise. Thank you. It's what a smart class. Right, so you actually grow, you should have made that up. You actually grow brain cells after exercise. You release brain-derived growth factor after exercise. For me, it's the panacea in terms of quality of life, et cetera, et cetera. And the last one, what's the last healthy habit that you can practice that really strengthens your frontal lobe? Meditation. Yeah. Yeah, and that's a bit of a plug for the next program here. So I could just rant for too long around meditation. It really does do the following thing for me. So this is, again, a slide from our cancer weekend retreats. Most of us are in the kind of a top dash curve, which is we have these kind of life challenges, and we get into kind of a state of feeling kind of anxious and nervous all the time, and that's generally how we help ourselves. And we don't even realize that we're here, right? Like a fish in water, don't realize that we're anxious. Whereas the bottom line is obviously the more ideal one. And as you actually practice relaxation, as you take care of yourself, you stay in balance, then the neuroplasticity of the brain says that you'll get better and better and better at whatever you practice. Okay, so take away, boost your confidence, power pose. 2 minutes. You don't do that in the interview, you do it 2 minutes beforehand. Right. Yeah. Although it's actually interesting, within the interview itself, you want to kind of match the interviewee. So when you're feeling really overwhelmed and want to be able to get to the reassurance part of your brain, the wise and kind part of your brain, you actually change your physiology. So the slow breaths innervate the vagus nerve that goes up to the brain, the parasympathetic nervous system. It's one of the few ways that you can actually prime your parasympathetic nervous system. And lastly, when you're having those kind of anxious moments going into exams or OSCEs or presentations, realize it's actually helping you. It really does get your brain to work better. And remember to find meaning, that this is about taking care of people. Being part of a team really is super important. You're now part of a team. And lastly, just keep your frontal lobe engaged by taking care of yourself.